German scientists began working with monkey tissue. They didn't know they opened the gates of hell. 1967. Hundreds of African green monkeys arrived in Marburg, Germany. They were supposed to help make polio vaccines to save kids. Technician Klaus did his usual routine: white coat, gloves. Suddenly, the blade cut through flesh. Blood splashed on his glove. Days later, Klaus's body started shutting down, 40-degree fever. Pain drilling behind his eyes. Then non-stop vomiting and diarrhea. Pieces of his insides came out. Then the nightmare began. Every needle mark on his body started bleeding. His gums, his eyes. Huge bruises spread under skin, like someone was punching him from the inside. Same thing happened in Frankfurt and Belgrade. 3 outbreaks, 31 infected, 7 dead. Scientists put a patient's blood under an electron microscope. The room went silent. They weren't seeing round viruses or rod-shaped ones. They saw long, twisted, snake-like filaments. Marburg virus. That's our first look at a filovirus. If Marburg was a warning, 9 years later came the real attack. September 1976, Yambuku village, Zaire, a mission hospital marked by extreme poverty, with only 5 metal syringes. Hundreds of pregnant women getting vitamins every morning. The virus spread quietly and efficiently through those needles. Weeks later, the village became hell. Fever, vomiting, bleeding from eyes, from skin pores. 318 infected, 280 dead, 88% kill rate. The village was almost empty. Same time, 700 miles away, a cotton factory in Sudan. 284 infected, 151 dead. 2 separate outbreaks, different viruses types, but from same viral family. Local doctor Jean-Jacques Muyembe went into the hot zone alone, risked his life, got samples out. A blood sample eventually reached Belgium. 27-year-old microbiologist Peter Piot opened the package. Inside, thermos cracked, blood and ice water sloshing inside. He put it under the microscope, saw something like Marburg, but not exactly. He and colleagues named it after a nearby river. Ebola. This outbreak ended by the old way: isolation, tracking, let it burn out. Over decades of outbreaks, scientists figured out how this virus kills. Step 1. Decapitation. Virus enters the body, locks onto immune sentinels, macrophages, and turns them into its own team. Then it deploys 2 weapons. VP-35 blinds the cell's danger sensors. No alarm gets sent. VP-24 blocks the signals. No backup arrives. The body is invaded. But immune system has no clue. Then the final blow comes from inside. When the immune system finally realizes it's losing, it doesn't retreat, but launches an attack. Cytokine storm, blood vessels shred. Clotting factors run out. Vessels become sieves. Liver, kidneys, and adrenal glands all fail. You don't die from virus. You die from immune system eating you alive. Fast in 7 days, slow in 2 weeks. For 46 years, our response barely changed. Isolation, tracking, let it burn out. 1995, Muyembe tried something. He transfused survivors' plasma into dying patients. Desperate move, small results, but it planted a seed. However, the biggest weapon, vaccine, didn't came. Because clinical trials cost money. Ebola only killed poor people. There's no market, no profit. When a disease only kills the poorest people, the world looks away. Then 2014, silence broke. Ebola hit West African cities. 3 countries collapsed, 28,000 infected, over 11,000 dead. Cases flew to Europe and to America. The world finally turned its head. But international aid wasn't there yet. In Kenema Government Hospital, Sierra Leone, Sheikh Humar Khan, the country's only viral hemorrhagic fever expert. Throughout his entire career, he built the only shield for his region. Trained nurses, set up testing, fought hemorrhagic fever with scarce resources. When Ebola hit Kenema, his hospital became the only place patients could go. Protective gear ran out. Nurses dropped one by one. He knew he was next. He kept putting on that suit every day until fever started. July 29, 2014. No vaccine, no drugs, no aid. Dr. Khan died right before dawn. What Khan had not lived to see, others built for him. That same year, Chen Wei's team from China flew to Freetown. The city's medical system had already collapsed. Flights stopped. Fear hung heavy in the air. In blistering heat, they built China's first high-level mobile lab in Africa, cut diagnosis time from days to hours. She brought China's Ebola vaccine, AID-5-EBOV, completed trials in outbreak zone. It was approved in 2017. 3 years later, that same tech became the COVID vaccine CanSino. From start to clinical trial in under 2 months. No preparation in Freetown, no China speed. Canada's RSV-Zebov vaccine achieved the feat of 0 infections 10 days after vaccination. It was approved in 2019. It's the first Ebola vaccine. Muyembe waited 25 years. His idea, survivor plasma, eventually became an antibody called MAB-114, built from one survivor's immune memory in 1995 outbreak. One person's immune memory, across a quarter century, became a weapon saves thousands. 2020, FDA approved it. From 88% mortality in 1976 to over 90% survival in 2020. It took 44 years to flip those numbers. Deep in the jungle, the virus still sits inside some fruit bat, waiting. But humans are waiting too, with vaccines, antibodies, and everything bought in half a century of blood. We've never won, but we've never surrendered.